Hello, everyone. My name is Joe Ginda, and I am very excited to be able to present to all of you the topic I chose for my evidence-based research project, which is implementing barcode scanning into the practice of patient transport into an acute care hospital in Northeast Pennsylvania. As I began to investigate a topic to begin my research for this project, I was asked two questions. As a healthcare leader, what is one thing that I am passionate about at work? And number two, what keeps me awake at night? My passion revolves around developing a culture of patient safety, but what keeps me awake at night is when staff do not use patient identifiers and wrong patients are transported to testing sites. Through answering these questions have led me to drastically change the direction of my research from an occupational safety coordinator in my original PICO to now using barcode scanning as a patient identifier to ensure patient safety transport, my now revised PICO. Everyday healthcare professionals make decisions based upon their reactions and behaviors to situations that impact a patient's life. But what if those decisions have a negative impact on patient safety? This presentation aims to provide evidence based upon research about how barcode scanning impacts adult medical surgical inpatients in an acute care hospital. Healthcare organizations prioritize patient safety in hospitals, and when patients enter these establishments, they entrust their health and well-being to healthcare professionals. Faced with uncertainty, they expect to receive care in a safe environment and with best possible treatment. Through fostering a stringent safety culture, organizations demonstrate to stakeholders and community members that they take patient safety seriously through the implementation of educational safety programs focused on patients' overall well-being. Through the institution's behaviors and norms, we ensure that our patients feel secure, knowing we have invested time and energy to guarantee their safety. Patient safety errors remain a significant healthcare concern, leading to potential harm and death. Some of these errors are preventable and start at the beginning of a patient's stay in the hospital. Healthcare organizations focusing on patient safety culture can influence how patients and stakeholders perceive the institution's safety and quality structure. Errors related to medication administration, unsafe environments leading to falls, wrong site surgeries, or wrong patients being transported to diagnostic testing sites are noted. Two such occurrences were reported over the past year, where each patient was misidentified by staff. These occurrences were initiated by the patient transport department not verifying the correct patient, and verification was also not conducted by nursing and testing site staff. A vaginal ultrasound was performed on the incorrect patient, and in the second case, it was realized by the physician that the wrong patient was present at the time of the study simply by looking at the x-ray. Such errors can create not only harm, but also emotional distress and mistrust about the organization and medical team. This study proposes an intervention focusing on using barcode scanning as a patient identifier for intra-hospital transport to diagnostic testing. The implementation of barcode scanning for patient transport contributes to the improvement of patient safety, quality of care, and promotes a culture of safety. The impact on all stakeholder roles as communication partners bring these groups together to work together to align themselves within the organization's safety culture. Barcode scanning for patient identifiers in transporting patients aims to improve patient safety, increase transporter user compliance, and reduce errors. The department leadership team is directly responsible for ensuring 100% compliance and efficient utilization of the process. Due to the scarcity of many incorporated standards, accurately identifying patients always results in positive outcomes. With innovative approaches and technology, barcode scanning enables patient safety standards to be incorporated into everyday practices. Project will follow Lewin's change management theory model as a framework for applying evidence-based research on barcode scanning using patient identifiers and the implications for noncompliance by transport staff. The focus for all health systems is the prioritization of health quality across the 6 disciplines of safety, efficiency, effectiveness, patient-centeredness, accessibility, and timeliness. In the current healthcare system, if healthcare staff wrongly identify a patient and perform tests on the wrong patient, this can imply various costs not only to the organization, but also to the human psychological cost if something adverse should take place. 400,000 patients each year will be the victim of preventable harm, and more than 200,000 patient deaths annually due to unsafe practices and negligence on the part of healthcare workers. The objective then is to identify the cause of these errors and simultaneously provide a solution. We can use barcode scanning as an effective factor in preventing adverse events that can lead to cost savings. Only through investing resources in technology and humanity can the organization benefit from new technology. Using strategic analysis, we'll look at integrating quality and safety through clinical informatics, technology, staff, and using best practices. Evaluation of system effectiveness and user acceptance using data collection and observations will also be noted. Nurses and clinical practitioners have used barcode scanning for years, so it comes as no surprise that this technology is moving beyond the nursing unit from medication administration into other parts of the clinical process flows to ensure patient safety. We can categorize barriers to this technology use as process issues such as inadequate training or negative changes to workflow processes, and issues related to technology, concerns, or negative implications related to workflows. Staffing and workload issues can also pose a barrier to successful implementation, leading to staff to create workarounds. This can include nursing shortages on units where transport staff will not utilize the proper channels to communicate errors to the command center dispatch, therefore taking the incorrect patient. The evaluation processes will include observational methods such as surveys, staff interviews, and direct observations. Data analysis collecting correlations to gain insights and locate process patterns, and using qualitative and quantitative approaches, looking at conditions and outcomes of the scanning processes. As the new workflow takes shape and implementation occurs, the barriers and workarounds are identified as critical. Feedback is gathered from audits and surveys from staff to identify common workarounds and reasons for not scanning, such as notes and charts being scanned instead of wristbands. The root causes of why scanning is not performed by staff are analyzed due to workflow issues or perceived inconvenience. Workarounds are addressed by clarifying policies and explaining the implications for not following policy. These challenges are addressed by retraining staff, providing ongoing education, and engaging staff by focusing on a culture of safety. Lastly, technology is optimized by reviewing the system design with clinical informatics and addressing those limitations to help streamline the new workflows. In conclusion, based on the evidence presented, barcode scanning serves as a crucial step towards achieving higher levels of patient safety and accurate patient identification in healthcare. Healthcare organizations worldwide are always facing patient safety events as a problem, regardless of their size and structure, and most of the technology advanced systems encounter their share of patient safety events and near-miss events for various reasons. It has become apparent that patient misidentification is a leading cause of many of these incidents. Misidentification of patients occurs at every level of the organization, including registration, transport, food service, diagnostics, and nursing. Each department has its own responsibility to ensure patient safety and must account for actions that deviate from hospital policy norms. When patients are put at risk due to noncompliance, it can lead to only patient harm, but also pushes organizations into crisis mode. As a key element of patient safety, the use of unique patient identification barcodes along with associated technologies and protocols is essential for achieving the patient safety goals of organizations. Thank you very much for your time, and I look forward to the feedback from my classmates on this project.